Are you or someone close to you having or about to start chemotherapy, immunotherapy, or targeted therapy treatments? In this video, we talk through common side effects of treatment and give you information to help you or the person you're caring for manage these side effects if you do experience them. Importantly, we'll talk about the side effects your treatment team need to know about quickly if you do experience them.
Anti-cancer drugs include chemotherapy, immunotherapy and targeted therapy agents. Chemotherapy damages the way cells divide and reproduce. Immunotherapy drugs boost the immune system to help the body find and destroy cancer cells, while targeted therapy agents block the mechanisms that allow normal healthy cells to become cancer cells.
These treatments work in different ways and have their own specific side effects, but they also share some common side effects. Chemotherapy affects the way in which both healthy and cancer cells divide and reproduce. Cells that normally divide and reproduce quickly, like those lining the esophagus, stomach, colon and rectum, as well as blood and hair cells, are the most sensitive to chemotherapy. That's why nausea or vomiting, diarrhea, infection and hair loss are common side effects of chemotherapy. Chemotherapy also interferes with the production of red and white blood cells and platelets. When the numbers of these cells drop in the body, patients can experience symptoms of anemia, such as fatigue and shortness of breath. If you experience any of these symptoms, let us know. A blood transfusion may be needed to increase your red blood cell count. If this is required, we'll explain why you need it and what will happen during the transfusion. You'll be asked to sign a consent form. And we'll give you the transfusion in the centre. It usually takes a few hours. The role of white blood cells is to fight infection. If your white blood cell count is low, you are at higher risk of infection. This is a common problem for people having chemotherapy and is something we'll monitor closely. Preventing infection once you start your treatment is very important. Good hand hygiene is one of the best ways to reduce your risk of infection. Always keep your hands clean, carry hand sanitizer and use it frequently. If you have cuts on your hand, always cover them with a band-aid, especially if you're working in the kitchen or the garden. And when you are gardening, always wear closed shoes and gloves and slip, slop, slap and slide on sunglasses to protect you from the sun. Wash your fruit and vegetables before eating. And if possible, avoid crowded places. It's also important to ensure that if your family and friends are unwell, they should avoid visiting you while you're having treatment. Remember, you can always talk on the phone, Skype or FaceTime to keep in contact. Once you've started your treatment, signs of infection to watch for include a temperature of 38 degrees or more, chills, shakes and shivers, feeling unwell, a cough or a burning sensation when passing urine. If you have any of these symptoms, attend your nearest hospital's emergency department as soon as possible. It's important that you have a reliable thermometer at home. You should ask your nurse how to use the thermometer correctly and how often to take your temperature. Remember, you can have an infection without having a temperature, so be on the lookout for signs and symptoms such as chills, burning on passing urine or a new cough. If you have an intravenous line, PICC or a portacath, check for signs of redness, swelling, tenderness or pus around the skin entry site. These can indicate an infection, so please advise your treatment team as soon as possible. Platelets are responsible for blood clotting. If you notice any unusual bruising or bleeding, let your treatment team know, as it may indicate that your platelet count is low. Go to an emergency department immediately if you have any sudden, heavy or uncontrolled bleeding. When your platelet count is low, it's important to reduce the risk of bleeding. So you need to be careful with sharp objects. For example, use an electric shaver rather than a razor to shave. You'll be told when you need to have a blood test. And sometimes Your treatment may need to be delayed if your blood count is low. Two of the most common side effects of chemotherapy are nausea and vomiting. Some people may only experience nausea, while others can experience both. Let your treatment team know if you are experiencing either of these side effects, especially if they're not relieved by anti-nausea medication. There are many different types of medications for nausea and vomiting, and sometimes it may take a short while until we find the best combination for you. Eating small, regular meals, not letting your stomach become empty, and avoiding strong-smelling or rich foods can help prevent or manage nausea and vomiting. For some people, the smell of cooking can make them feel nauseous. Having meals pre-prepared or getting someone else to cook can help. Peppermint and ginger products such as mints and teas, as well as sipping water regularly, can be effective for reducing nausea. If you're taking over-the-counter or complementary medicines, always talk to one of the Cancer Centre pharmacists, nurses or doctors so they can check there's no risk of a reaction between these medicines and the treatment you're receiving.
Okay, thank you. Nausea and vomiting are common side effects of anti-cancer drugs. For most people, these can be managed well with medication, but there are times when the medication is not effective. If you experience persistent nausea or vomiting and you're unable to eat or drink, it is important to go to the emergency department of your nearest hospital. You may need intravenous fluids to prevent or correct dehydration and may require admission to hospital.
Chemotherapy can cause mouth problems such as ulcers, a cracked tongue, bleeding gums or thrush, which is a white coating on the tongue, cheeks and back of the throat. It's important that you follow a strict mouth care routine from the start of your treatment to keep your mouth as clean as possible. A mouth care booklet is available from our centre. Your doctor may also suggest you visit your dentist prior to starting treatment. If you notice any soreness or pain, ulcers, white patches or bleeding in your mouth, tell your nurse or doctor. A sore mouth, sometimes called mucositis, is a common side effect of chemotherapy. It can affect any part of the digestive tract and can take several weeks to clear after treatment is finished. Be sure to let your treatment team or GP know if it isn't improving.
A dry mouth can also be a common and uncomfortable side effect of your treatment. It happens because cancer treatment damages the salivary glands, so they make less saliva. When this happens, eating can become painful or a person's taste changes. Making sure you drink plenty of fluid, about 1 to 2 litres a day, and keeping to a regular, thorough mouth care routine is important.
Our mouths are a key source of infection. It's important to brush your teeth and tongue gently after each meal and at bedtime using a soft or electric toothbrush and a mild toothpaste. We recommend you make a mouth rinse using a 1/4 teaspoon of salt or a 1/4 teaspoon of bicarbonate of soda in 1 cup of warm water and use daily after brushing. Another possible side effect of your treatment is diarrhea. It's important you tell us if you start experiencing this, as it can quickly lead to dehydration. We can provide medication to ease or stop the diarrhea. Eating 5 or 6 small meals each day instead of 3 large meals can also help control diarrhea. Include foods that are easy to digest, like bananas, steamed or boiled potatoes without the skin, white rice and pasta, white bread, well-cooked oats, steamed chicken without the skin, white fish, eggs or jelly.
It may be helpful to keep a diary, as sometimes it can be very difficult to remember everything when you are feeling unwell.
Ensure you accurately record how many bowel motions you have each day, what medications you've taken, and how much fluid you've been drinking. Many of the medications used to manage side effects can cause constipation. Increasing your fluid intake to 2 litres per day can help. You can also try increasing your fibre intake with wholemeal bread, pasta and cereals. Prunes, legumes, baked beans, licorice, fresh or cooked fruit and vegetables, pear and prune juice can all help you become more regular, as well as gentle daily exercise like walking.
You may need to take a laxative or stool softener to help get things moving. If you are unsure what to use, speak to the pharmacist, the nurse or the doctor. It is important not to let constipation continue for more than 2 days without using medication to provide relief.
Chemotherapy-related fatigue is an unusual tiredness which can have a big impact on your quality of life. It can make doing the most simple day-to-day things difficult. Some people find this frustrating, but people experience fatigue differently and to different degrees. Be sure to tell us if you're feeling unusually tired, because it may be because you are anemic, or there may be another cause which can be addressed. To help manage fatigue, organise your activities around your energy levels. Try to get a good night's sleep. Eat a well-balanced diet. Our dietitian is here to provide advice on eating to stay healthy. Keep your fluid intake up. Remember to aim for around 2 litres a day. Some people say they have difficulty concentrating, focusing and remembering things after their treatment. This is sometimes called chemo brain or chemo fog. Don't be too concerned. These problems usually improve over time.
It's important to tell us if you're having any thinking or memory problems and if they're affecting your day-to-day life or return to work. There are strategies which can assist with managing this problem.
If you notice a rash, whether it's itchy or not, please let your doctor or nurse know as soon as possible, as it may be related to one of your treatments. International research shows that regular exercise is one of the most effective strategies to manage fatigue and maintain general health and well-being during cancer treatment. It can enhance recovery, help with side effects and reduce the risk of cancer returning.
Ask for advice about a referral to an exercise physiologist or physiotherapist. We will develop an exercise program tailored specifically for you. Regular exercise could be walking, going to the gym, or any exercise that you did prior to your cancer diagnosis.
The Cancer Council WA provide an exercise program to build strength, reduce fatigue, improve fitness and quality of life. You can contact the Cancer Council for more information. Having the opportunity to talk about how you're feeling is just as important as addressing your physical health. Every member of the Cancer Centre team is ready to listen to your concerns, but sometimes people need specialised support. We have both pastoral care practitioners and a clinical psychologist based in our Cancer Centre.
Sometimes talking with someone who is not part of your immediate care team is helpful. Pastoral practitioners are available to listen to and support you and your family members. This service is available to all patients at any time in the Cancer Centre and the hospital. Let your care team know if you would like to chat with someone about how you're going.
Many people have told us that receiving help or support for any fears, worries or concerns is invaluable.
Tingling in your hands or feet, known as peripheral neuropathy, can be a particularly challenging and distressing side effect of treatment. People talk of a change in sensation in their fingers and hands or toes and feet. That can make it difficult to do things like walk, keep your balance, drive, manage buttons or hold cups.
It's very important you tell your doctor or nurse at your next appointment if you notice any of these sensations. The longer they are present, the more difficult they are to manage. In recent years, we've become more aware of the need to be sun smart. Chemotherapy can make your skin more sensitive to the harmful effects of the sun, so you'll need to take extra care as your skin will burn much faster than usual.
You may find it helpful to moisturise daily with cream that doesn't contain any perfume, which can irritate your skin. The cream will prevent your skin drying out and becoming itchy. If you do notice a rash developing, it is important to report this to your nurse or doctor.
Hair loss is a common side effect of chemotherapy. The use of cooling caps may help minimise hair loss for some patients receiving chemotherapy and are available for use in our centre. If you're interested, please ask your doctor or nurse if you're a suitable candidate.
You can take part in a Look Good, Feel Better workshop that is free to people undergoing cancer treatment. If you would like advice about how to look and feel your best during treatment, this is a wonderful programme. The workshop allows men and women to meet others going through similar treatments and to share experiences and advice about keeping well and assist with information on how to wear wigs and scarves.
Chemotherapy can cause a metallic taste and food may not taste like it should, making it difficult to maintain adequate nutrition. You'll be asked to weigh yourself when you arrive in the centre before each treatment. This will help us determine if your current intake is adequate. A healthy, balanced diet is important to your treatment and recovery. For some people, eating smaller amounts of nutritious food 5 or 6 times a day works well, while others use dietary supplements to boost their nutritional intake. Our dietitian will be happy to develop a diet plan that best suits you. Please ask if you'd like to speak to them.
We understand that talking about your side effects can be quite daunting, particularly in the early stages of your treatment. We would like to reassure you that our staff are here to support, advise and care for you.
If anything is worrying or troubling you, please talk to us. We're here to keep you safe and do all that we can to ensure you are comfortable before, during and after your treatment.